chairs up there?
I think it's okay if I just sit here and I've been.
Okay, all right, good. So Amy's. All right, we are live. This is Senate Health and Welfare, and it is Friday, February 6th. And the temperature isn't any higher than 6. So cold out.
In here, it's nice.
And in here, it is getting a little warm in here. I will admit that. I will admit. So this morning, we're going to go through the Budget Adjustment Act and what is in it relevant to our area. And we'll just, Amy, we'll just let you take us through. Do we have this?
Would you, Amy Cook from the Joint Office, would you like, I have some copies.
That would be
like
good.
me
I think that would be helpful.
Okay, great.
Do you want to put it up on the screen?
I will, yeah.
All right.
There's an updated version than what I provided you. So you might want to go to use the. My screen share has failed. It's starting to. Why don't I get started and then I might try to rejoin. I think one of the biggest fears of staff is when this happens.
Oh, we could talk
So
amongst
here
ourselves.
we are.
I'm happy to talk about my collar.
Oh gosh, this is not working. I don't know why this is here. I'm going to.
For the heat in the room. I did, I caught 8 degrees. Oh, John's the answer sniper.
There we go.
Bloggers know how many trees they've cut.
Oh, perfect. There we go.
Oh,
They keep a log.
that's a good one. That's a good one.
All right, there we go. Thank you for viewing.
To find the time,
All right.
find the time.
So as you know, the House passed the budget adjustment last Friday. It's now in Senate Appropriations. And so what I've done is I have a couple of documents that you can go through to help identify what is in the budget adjustment that is sort of in the purview of your policy committee. So there's 2 documents I'm going to go through, and then I'll reference other documents for you as we talk. So the handout that I provided includes changes that the House Appropriations and the House made from the governor's proposal for the budget adjustment. So as you're looking through it, you'll see on the left side, there's the VA sections of H790. So if you want to find out a little bit more about that item, you can go to the bill and read more about that section. And then just for reference, sometimes it's good to see what the reference is in Act 27. Because the budget adjustment is amended Act 27. And then just sort of the title of the section and just a little bit about what that changes. So we can just get right into that unless you have any questions. So the first section is an addition above what the governor recommended. It's 45,000 general fund increase to providers for HIV and harm reduction services. So there's always an appropriation every year, and this increased each of the providers in that section. Then we went to section 37 in the bill. There's a $30,000 increase for Meals on Wheels. And I think it's specifically to independent living. And that's a grant out to them. And then section 40, there's sort of 2 things happening in this section. Dale has requested an appropriation for extraordinary financial relief for $14.5 million, but the House reduced that by $300,000, and then moved that into rate increases for Tier 1 enhanced residential care and the AAA case management. The next section is 51. There's a couple of items, and this is really the one times. We were just talking about changes in base. This is just a one-time appropriation that will have to be discussed again in actually the 27 fiscal year. So this one is for non-emergency medical transportation funding, and so it's an $800,000 gross request.
Sure. We had heard, for the record, normally I was going to fiscal office, I think, we had heard that, this is to help with a shortfall for the providers, for fiscal year 25, so it's kind of helping to backfill the shortfall. And I said one of the reasons that it's coming in higher is that because of some closures of practices, a lot, they have to drive people to farther, so the costs are going higher. So that's where this request is making.
See a lot of this going forward.
The next section of one times is 167,000 general fund for the Bridges to Health program, which my understanding is that it's moving from maybe UVM and it's moving to another
Yeah, no administration
and this is sort
of
of
the program, yeah.
yes, so there's sort of like a bridge funding for that. And yeah, the next one was substance misuse for recovery centers. So in the bill, it specifically identifies what providers will receive what specific amount of money.
So, right, and within the bill, there's a list of the actual recovery centers across the state and how much money they need in order to true up their budget from last year. Section.
Well, so can we see that list or?
I can pull it up.
It's in the 790. All right.
I thought that you had asked that question, so I had it already. It's right. No, it's right here.
Let me do it all.
But you can look at 790. And I have the section you know, on the handout that helps you find it.
Great,
Thank you for the point. But here are all of them. The turning point sectors are the primary centers.
So it really is about how much more money they needed to cover their costs for the 26 fiscal year. And so the budget adjustment allows for the administration to begin to juggle dollars around. And then the House was actually was responsible for building this particular section, putting the dollars in for each of them. And there's language with it, so it can be a little flexible.
And this is coming from the substance misuse special funding.
Yeah, right.
Yeah.
Looking at that. It comes from the special.
Which is kind of just one.
Sorry, what page is that on the actual bill?
Oh, yeah. See?
This is not related to the opioid settlement.
Right.
Around page 30.
Okay, great, thank you.
I'm sorry, when Amy was talking about, I'm just not sitting over there because there's not a lot of space. Freshly cooked up to find, but I wasn't paying attention because I was multitasking, but when Amy was talking about the long-term care rates, that one there was some information that they had received. We did a 2% increase for home and community-based providers last year, and it was based on a rate study. And when
That's right.
we got the rate study, it was just showed what it should be, but when the deed was implemented, in the rate study, there was some who got increases, but the ERC ones actually got a decrease. And it wasn't apparent to the legislature when that happened. And so that money is to hold them harmless by not giving them 2% from last year, but at least making sure they don't go back below where they were.
Right.
But this has annualized, it's 300,000, 260K this year, but it's annualized, it's $1 million. So if you do this in BAA, you have to carry $1 million in the budget for the 27 as well. Now, do that and said fine with that. So, and then the triple A's, that was, because of the way it was done. They got rate increases for some stuff, but then not for others, and this was to try to hold them harmless as well.
Right, so now we are at. Yes, the next item is another one-time, for a grant to the Vermont Food Bank, and their original appropriation was 500,000. The House added 400,000 for a total of 900,000 for fiscal year 26. Now we're getting into sort of the language, and this is just a repeat sometimes of what's happened above, specifically for this one. But this just sort of, the one we saw before, the B12, 312 is the actual appropriation, and E312 is the language that specifies which entities will receive the funding and the breakout by community or by organization. The next one is some language around DCF OEO. There is that the OEO had a proposal to provide sort of, of this money, provide the community partners funding for staff associated with shelters to help run the shelters. And the House redirected the purpose of the money to sort of the same community partners. Maybe there's different ones, but they identified the actual specific 13 community partners and to restore their grants to the fiscal year 25 level. So I think there may have been some misunderstanding between what the legislator's intent was and what the proposal was before by the partners. So the House has made this proposal. And then the next few sections are just language. Section 83 is a progress report. I think it's due in April to identify solutions, how to ensure uninterrupted services for individuals receiving support during fiscal year payment reform.
What this was, it was placeholder language. We had heard from DAs in the House about how with the new DA payment reform, they're having some cash flow issues, timing, the way it's paid, and some of the agencies are really struggling. So there's some language that we were working with DAs and Dale to try to come to an agreement on that would try to boost the rates and try to make things self-solve cash flow and some of the risk concerns that they have. But we ran out of time. So this was placeholder language to get it signed. And we're still working on it.
Still working on it.
Okay. That's helpful, because I do hear that sometimes the truing up takes, a year and a half or, thereabouts, which is really difficult.
Yeah.
So I'm hoping we can fix that.
Yeah, yeah, we're trying to do that, to work on.
And the next two items I have, I most definitely will have Nolan to explain. They're not necessarily direct appropriations. It's more language around
Oh, you're looking at 84?
84 and 85.
Yeah,
Yeah.
so that
Yeah.
relates some to Brattleboro and
You may want
what, right, they got captured in language where they have a clinical trial going on, and it would upset the work they're doing with the grant. They didn't have the language.
Sorry, before we move on, would it be possible to go to the language in the bill that speaks to the harm reduction services?
Sure. Talking about number section 77.
Yeah.
Yeah, 77. So this is the language. We call this sort of annual language. It's been in every appropriation bill for many years. And so they've increased the appropriation to 340,000 in the general fund.
Yeah, okay. It's different from 25, which is the HIV and harm reduction services. That's okay, so this is different. Yeah.
It adds green. And then it's distributed to each of the services that provide pension services.
Got it. All right, thank you.
Now, if you'd like, I can, kind of take you anywhere from here. I thought I would go over the highlight document that the House provides, on the floor that identifies some other things that are in the governor's recommend that I haven't talked about, that you may be interested in, but the House agreed to it. So a lot of the bill is very technical in nature in that, so one of the items, for example, is about caseload and utilization around Medicaid. And so that's typically a number that's agreed upon with JFO and the administration and FEVA. And so there isn't a lot of change that can happen around those. So I didn't specifically talk about those. And that's some of the stuff that the governor and the House agreed to. But I want to be transparent at the same time to your committee. So I can go over those items, or, you can read the bill and read the web report and ask us.
Let's do what you had in mind.
Okay.
That you thought would be helpful.
It shouldn't take too long. And this may look somewhat familiar to you because the Senate also does a highlight document when you're talking about the bill on the floor. So let's see if we can get this on the time screen. So I'm not going to go over every item, so we won't go over, state police over time.
Fine.
But, so we talked about the extraordinary financial relief, the $14.1 million that's in the budget adjustment for Dale. We didn't talk about there's $390,000 of general fund for traveling nurses.
So Amy, what would be
Yes.
helpful would be to link that money, if
Mhm.
wherever possible, with what we've just talked about here. So the
Yes.
extraordinary relief would be part of that 2%
That's right. So,
increase.
that one's part of, section 40,
Second, right.
on your handout.
Yeah.
And so for the Department of Mental Health, that's not on your handout. And,
So
that one is part of a contract. And so the contract is higher than budgeted, and therefore there's an adjustment. So
it adds $390,000 to the current contract, and then it brings it up to, I forgot the levels, about 4.5 million, I think.
yes,
Yeah. Total.
let's see, we talked about the 1.3 million, and that is on section 81 of your handout, this for housing opportunity partners. We did not talk about the Wyndham Centered Crisis Stabilization Program, and that's at DCF for crisis beds for youth. So that's an increase of 1.9 million. And then again, that's sort of part of their contract and work that they're doing. We talked about the Medicaid rate increases. So again, that's back up into section 40. We didn't talk about NEOCs, and I don't know what your area
No,
is.
it's okay. I
Okay.
think that there is the WellPath contract in there, but we haven't dealt recently.
Yeah.
We do it.
Yeah, so this is just based on population.
Yeah, if I could just add something to section 40, the governor for the nursing home extraordinary financial relief, or whatever they call it, EFR, the governor had proposed 14.5 million. And then the House to pay for the ERC one and the AAA case management increase, was they took it out of that. So that's 14.2 now, so it's 300,000. Now they're both matchable under local commitments, so there's no loss of federal money. It's just shouldn't have that.
Just how it's used.
Yeah, so they just took it out, so 300,000 less for EFR. Yeah.
Thank you. This is the next part isn't on your handout. The funds caseload utilization, as I mentioned before, $34.3 million. That's probably gross. And then we have $270,000 general fund for 2 limited service positions that I think was previously funded through federal grants. And that money is no longer available. And so now those positions are very integral to the work that they do at DCF around the housing opportunity program. So it's net neutral. It must have gone from grants up to personal services. All right, so that's all in the base. So now we're talking about one-time general fund appropriations. We'll go to, third bullet. And that would be connected to section 51. Oh, these are all section 51. So we're back to the non-medical emergency management for the $800,000. We talked about bridges to health. We talked about.
So there's an increase for the non-emergency medical.
Correct. That is an increase to what's already in base.
Because of the travel needs and that. Right.
Yes. The next bullet we can talk about is the general fund to migrate, the Vermont Health Connect to a cloud-based platform to maintain compliance with federal requirements. So it's sort of a must,
A necessity.
for the fund.
Question, can any of this one-time money needs be covered underneath the federal grant for the rural hospitals?
No, this would not involve the Rural Health Transformation Grant funds or process. That's totally different, segregated, right? This is only truing up the budget from last year to help folks out and make sure that everybody has what they need to go forward. You could have said that.
Talk about the transportation, because that's a significant amount of money. Do we have details on, is that purchasing a vehicle or is that just paying for the volunteers that we?
Yes,
Yes, all of it.
I don't know about buying vehicles, but I do know about
Paying for the,
paying for gas.
yeah, okay.
Yeah.
And I think the last one is, which we've already spoke about, which is the report, from Dale, to the legislature on sort of that placeholder language around the report. So that's, I think, the general grand scheme of the bigger requests. I won't go over this other document, but I wanted to let you know, this is on your committee page. It's the worksheet that the governor proposes, and there are, really gets into the weeds and details of every single item and ups and downs. But I think what we've gone over is really the highlights of what's requested.
So, and I guess the question for us is there anything there that looks totally unacceptable, or that we wouldn't want to support? This is the one of the issues.
And that's on the Senate Appropriations page. Yeah.
Any questions?
I mean, I'm happy that there's language in that we're gonna be supporting language for, to support the DAs, but is there any appropriation attached to that or?
Not at this time, no, but, I'm working on it. We'll keep working on it. This is an issue, free case management issue and a payment reform for the DAs. Now has been going on for a year. And we heard about it here, we heard about it in joint fiscal. And it hasn't been resolved through the budget or through the budget BAA, budget adjustment. So the House put in language that would say, okay, come up with a plan by April 15th. That's the language that's in the bill now. I'm continuing to work on that, and the issue is once you put in place the money to cover services for a period of time for utilization, then we have to know, do we have the money? So all of that in what I'm trying to do. Over till it's over.
And I'm sorry, one other question. Does the harm reduction services, does that include, needle change, or is that something different?
I think it does.
Yes, it does.
Yeah,
Thank
yeah.
you.
So we have an increased need. And in different places at least. Okay. Any other questions for Amy or Nolan? This, the appropriations committee has been walking through this and really understanding where the money's coming from, where it's going. What monies are contracts that are, you can't really move money around from contracts. They need it to go forward. What money is needed based on some oversight from the previous year. The 2%, the Brattleboro issue, all of those things, trying to fix some little problems along the way. This is actually, I shouldn't say this, but it is a more benign BAA than we've had in the past.
Yeah.
What is your sense of this?
Yeah, there's, budget adjustment should really not have a lot of policy in it. It truly should just be an adjustment to the bill that you already agreed to, based on new things and new data. So that's really how this budget adjustment feels. Yeah, it's more in line with that.
Okay. Other questions? Good.
Great.
Well, no, thank you. Thanks for putting this together. This is really
Great.
Helps. And with explanation, it's all great. Yeah. Good, thank you.
Sorry,
So, Committee, if you have any specific urgent questions, you can ask Amy or Nolan, and I'm happy to guide you if you need that. And then if you have concerns about what's in here, certainly bring it up, and you can bring it up in consideration. Okay. I have a card that we received, and I will pass it around so you can see it. Are you allowed to hold cards?
He's doing it.
And it still works.
Charlotte,
Yes.
I had an email last night about 9 o'clock from Representative Burke, who wants to testify on 8545. If he's available, we could ask him if he's available at 10:15, if he's not 10:15. Anytime between 9:30 and 10, or a little after 10. He's on the floor now, so he's probably not available. Maybe we'll have him down on Tuesday.
You only have me in the then.
Yeah, so, okay, so we have Katie till 10.
I don't know if that.
Yeah, we are not gonna put anybody else in that chair.
Okay.
Thank you. But my response to it, and I have some Lauren and meeting. Oh, okay, yeah.
Yeah.
Thank you. He's rather in and I'll ask her. Because sometimes our agenda changes and I don't know. 5:45.
Just in case. Yeah, just in case you need.
Just in case. Okay, yeah, she's from the Secretary of State's office. And you could. The health department. Oh, she's from the health department. Oh, that's my brain. Yeah, I gotta put her in the right spot. Come on up. It's Friday. And the Olympics is starting. The Super Bowl is Sunday. Woo!
That's our happiness for today.
That's our happiness for the day. Lauren, thanks for being here. We're going through 545 and we may reach out to a friend as we go through. And if you feel there's something you'd like to share, just raise your hand.
Great. Thank you so much, Senator. I appreciate it.
Good. And I do understand you are at the Department of Health. This is taking a while to drill.
I wrote it in my caption so you can see.
Thank you. Okay, Katie, we're walking through 545. Do we have recommendations for amendment in the bill we need to look at?
Good morning. Hey, legislative council. I'm happy to walk through the bill that came over from the House again, if you want to take another look. Yesterday, we looked at instances of amendment, so I could start there. You can, whatever's best for the committee.
Let's start with the proposal of amendment and
Okay.
make a decision about including those in the bill.
Okay. So just to refresh your memory, this is an amendment to H 545 that contains instances of amendment. So this is different than a strike all that integrates all of the amendments in the document. Which means that in order to sort of see how some of these pieces fit together, you will need your bill as introduced. The first instance of amendment is in section 3 of your bill as introduced, and that is where the existing Vermont Immunization Advisory Council authorization statute exists. This language is striking out the existing subsection B that is in the bill as in the bill as passed the House and putting in a new subsection B. You'll see that it contains most of the language that the House sent over. The change here is removing the executive officer of the Vermont Board of Nursing or designee and the executive officer of the Vermont Board of Pharmacy or designee. Although originally requested by OPR, OPR felt that it was more appropriate to have the practicing APRN and the practicing pharmacists in subdivisions 10 and 11 solely, instead of having both somebody from the board and a practicing provider. So they requested that those two items, those two members come off the list.
Okay, what page of the bill?
That's, well, we have different documents.
Here we go.
So it's
Okay,
section 3, subsection B,
section 3.
section 3 of your,
Seven of what you.
Thank you. Okay.
Wait,
thank you.
All right,
I think I'm right.
okay.
Should be a list of members.
Yeah.
And then in your document that you're looking at, the
Oh.
subdivisions 2 and 3
Got it.
are the two positions that would be removed under this proposal.
Okay. And then we're putting people who are active participants.
They're already in.
There,
Yeah,
so we're
so
taking these two out.
Yeah.
And we're reducing the number on the.
yes.
Okay.
Okay, so that is the first instance of amendment. The second instance of amendment is to section 7 of the bill that came over from the House. This is a section specific to pharmacy technicians.
Page 13.
Great. So we have some reorganization happening to this language, but what is new is this list of authorities for a pharmacy technician to administer immunizations. So this list under 2. So it reads that a pharmacy technician shall only administer immunizations when a licensed pharmacist who is trained to immunize is present and able to assist with the immunization as needed, pursuant to a valid prescription by a practitioner, a standing order made by the Commissioner of Health, or a protocol approved by the Commissioner of Health under subdivision 2023 V2A of this title, which is the section and section 6 of your bill specific to pharmacists. And to patients 18 years of age or older and 5 years of age or older seeking an influenza immunization, COVID-19 immunization, and subsequent formulations or combination products thereof. So that would be the whole rewritten phrase, keeping that, adding that authority, list of authorities in. So that is the change that OPR is requesting. And then, in the third instance of amendment, striking out section 13 in the bill as it came over from the House. That is also a section, that's the corresponding section on pharmacy tax.
Hang on a second.
Page 22. Just break up the whole section.
It deletes the whole section from the bill. The effect of doing that is that there will not be any changes to the section we just looked at on July 1, 2031. What is being proposed in that second instance of amendment would become the new status quo, and it wouldn't revert back to anything. That would just be the language moving forward, which is why we wouldn't need section 13 anymore, because that section takes effect July 1, 2031.
Okay. Okay. Questions? Okay. So it'd probably be helpful for us to digest this over the weekend. And then we're coming back to it on Tuesday. And then we'll do our final markup on our proposed amendment, and I'm looking to vote on Tuesday. I know that Representative Burt, as I understand, had a proposal on the floor for an amendment that wasn't accepted. He also was involved in I think he testified upstairs, I'm not sure.
He definitely presented his amendment to Human Services. I don't know if he presented it anywhere else.
Yeah, so he sent the note last night. If, Charlotte, if you wouldn't mind sending Representative Burt a note, and if he's available, he'd have to get off the floor. I hate doing that to people, but if he's available this morning by, we need a break before we go to, by 9:15, before 9:15, that would be good. And then, 10:15. Thank you very much. 10:15. And if he's not available then perhaps he would be available on Tuesday at 10 o'clock, when we begin.
So is there an interest in having this as a strike all instead of instances of amendment with that?
Committee, what do you think in terms of presenting it on the floor?
I think that would be nice, but that's just me.
Okay, how difficult is it to do so we can look at it on Tuesday? It's not difficult. Let's do it. Yeah. I think it's much easier for us, and then it's much easier for the other senators to understand what's in the bill. I don't anticipate anything additional, but we'll certainly listen.
Okay, so it'll essentially be the same amendment. It'll just be presented as a strike off.
Thank you. That's good. All right. Anything else?
Not for me, unless you want to look at the underlying language.
Let's do that. Let's go through it. We have a little bit of time, and then we'll take a break before we go into room 11. Okay. We're going into room 11 at 10:30 with the House healthcare. Hope they'll be there.
Okay. So here is the version of H 545 that passed the House. I'll go high level because I know we've gone through it. But I know you like to refresh your memory on it. So the first half of the bill takes effect on passage and the language only stands for 6 years. So as of July 1, 2031, most of the language reverts back to the way it is in current law, although not all of it does. So in section 1, we have the definition of recommended immunization. And again, this definition means something very specific to mean that the Commissioner of Health is making a recommendation about the recommended immunization schedules for children and adults. Then we have amendments to the existing immunization program in terms of how immunizations are purchased and how they're funded. There are some changes here. A lot of it is updating the language around recommended immunization. And then you have some more technical changes. Okay, that brings us to section 2 of the bill. This is all new language, and this sunsets on the July 1, 2031 date. So this language is in effect, would be in effect for 6 years. That the commissioner is to periodically issue recommendations regarding, and we have a list about what those recommendations are. Which immunizations children and adults are recommended to receive. The age at which each immunization is recommended to be given. The number of immunization doses that are recommended to be administered. Recommended amount of time between doses of an immunization. And any other recommendations regarding immunizations necessary to promote the maintenance of public health and disease prevention in the state. And then the subsection B is the guidance on how the commissioner is making these recommendation decisions. First, the commissioner shall consult with the Vermont Immunization Advisory Council. That's the membership we just looked at. And then in subdivision 2, considering recommendations for immunizations issued by a variety of groups, including the CDC and various professional organizations. In C, this is the language that creates the liability immunity. A healthcare professional prescribes, dispenses, or administers an immunization in accordance with the commissioner's recommendations are to be immune from civil and administrative liability for immunization caused adverse events unless the professional's actions in prescribing, dispensing, administering constitute gross negligence, recklessness, or intentional misconduct. And D, this gives the commissioner a standing order, authority to issue a standing order authorizing healthcare professionals, including pharmacists, to prescribe, dispense, or administer recommended immunizations, as long as they're acting within the scope of their professional licensure. In subsection E, the department is to prominently display information pertaining to the recommended immunization schedule on their website, including how to access those recommended immunizations. And in subdivision E2, this is language that if the advisory council and the commissioner were to have different recommendations, if those weren't aligned, then any documents the department is producing has to note that. In subsection F, we just are cross-referencing definitions from the previous section of the bill. Section 3 is the language with the existing Vermont Immunization Advisory Council. We looked at the membership already this morning. I'll skip over that. We have some changes in C to the council's duties because now they would be looking at the recommended immunizations. For the first time, that language is being added. And then in subdivision C2, we have a provision that the Secretary of Education or their designee and the representative of public school is not, those two individuals are not voting on the recommended immunization schedule. So this subsection C here all reverts back to the way it currently is as of July 1. Then we have some language about how the meetings are organized. Next, you have two sections.
Wait, it reverts July 1, what year?
2031.
Yeah, thank you.
Yep, sorry. top of my page 10, we have the next two sections on health insurance coverage. So both of these sections currently reference CDC recommendations. The change is to instead reference the commissioners recommended, the cross-reference for the commissioners recommendations. The immunizations would still be at no cost to the patient. So I'll skip over those two. The next two sections, sections 6 and 7, also take effect on passage. The first section has to do with pharmacists. This next section 7 has to do with pharmacy techs. This decouples the link between pharmacy authority and CDC recommendations, and instead the link would be with the commissioner's recommendations. So that is what is happening in section 6. You'll see that here, that what's authorized is recommended immunizations, those, and we have that's a defined term to mean those that the commissioner has recommended instead of language about the CDC. Section 7, we already looked at in your amendment. So the proposal is to change this for the OPR recommendations. And then we get to section 8. Section 8 is where the time frame kind of switches. So we reached the halfway point in the bill, and now instead of things taking effect on passage, the sections are taking effect on July 1, 2031, with the goal of reverting back to the current status quo, again, with some exceptions. So you have the definition of recommended immunization going away, and instead you're using the term immunization in this draft. Instead of the recommendations being from the commissioner, they'll once again be based on CDC recommendations. What you are keeping from section 1 is this language that an immunization means a vaccine or other immunizing agent that provides protection against a particular disease or pathogen. Most of the changes are in the section are to revert back to where the language currently is. So I will skip through this. There on my page 17, G1, you'll see that there are these ellipses here in line 7. That means there's statutory language here, but we're not changing it. So what those ellipses signify in this case is that there were some changes to the list of the membership for the Immunization Funding Advisory Council. Most of those changes weren't substantive, but sort of structural, but those changes are being maintained is what those ellipses signify there. The next section, section 9, is the Vermont Immunization Advisory Council. You see these same ellipses on line 9. So subsection B is being maintained the way it is under section 3 of the bill. But subsection C, as I said, is going to revert back to the way it currently is. And that's why we have to show that change. Next are the 2 sections on insurance coverage. And these 2 provisions go back to the way they are and under the current law. So that's sections 10 and 11. Section 12.
Wait, 10 and 11.
Go back to
Go back.
the status quo, the current status quo. Section 12 is the pharmacy section. This is reverting back to the way it currently is. It's reverting back to the status quo, so referencing the language about the CDC. And now, if you accept the OPR amendment, you will no longer have this section 13. It will say deleted because it is their goal that the language that we looked at for section 7 would be maintained moving forward. So section 13, when you see her strike all, will say section 13 deleted. And that's why, because there's no change to be expected on July 1, 2031 for that section. At the end of the bill, section 14, this repeals section 1130A. That is section 2 of your bill. That's all the new language that allows the commissioner to provide recommendations and outlines what the commissioner has to take into consideration. So that section of new law will go away entirely on July 1, 2031. And then you have the effective dates. And we have this section, meaning the effective date section, and sections 1 through 7 and section 14, they all take effect on passage. And then sections 8 through 13 take effect on July 1, 2031. So I think we've kind of covered that as we went through.
Good. Question.
So what I remember, we went through this the last time, is if Vermont's recommendation of what people should get is different than the CDC. And if a vaccination that we recommend is not on the CDC's list, then if in fact there is an issue that whatever that fund is or whatever that the individuals would be able to tap into would not apply to the vaccination that is not on the CDC's list. Is that correct?
Are you talking about the federal program?
Yes.
Currently, the federal program is still covering the immunizations that are
On
But they have-
CDC's list.
on the CDC's list prior to them reducing the list. So that program is still covering all of the immunizations. It sounds like from experts in the field that it's anticipated that it may not always cover those, and it may as
Right,
Yeah.
that was the part I was concerned about.
Yeah.
And if in fact that were to occur
Mhm.
on the whatever they're posting that says, here's the recommended vaccines,
Mhm.
that maybe there should be an asterisk next to those that make people aware that that federal program would not apply to
to those
the,
immunizations.
just so that they're aware.
But that is a policy decision.
So I see Lauren Lehman of the Department of Health. Lauren, can you comment on that suggestion?
Yes, thank you. Lauren Lehman, General Counsel, Department of Health. So the Vaccines for Children program is actually purchased through the state. So we pay the federal government and then we distribute the vaccines for free to providers. So in this situation, and then because we're a universal state and also provide vaccines to adults, you might recall Meredith Plumpton's image where there's all these funding sources kind of going into the funnel. So there's also health insurance funding as well as this Vaccines for Children funding and a little bit of grant funding for certain populations. That if the Vaccines for Children program no longer offered a vaccine such that it was covered under the state contract, the insurers would pick that up in their cost of putting that in their cost. So it wouldn't be onto the patient. The patient still would be receiving the vaccine cost free.
So it's a different question, Lauren.
Okay.
So maybe state your question again.
Yeah, well, I'm not concerned about the cost of the actual vaccine. It's if in fact the patient has some adverse reaction to that vaccine, as I understand it. If in fact it's on the CDC's list or the current list, then there's a fund or something through the federal system that protects the individual. They wouldn't have to sue by themselves the vaccine manufacturer. But if in fact down the road, if it's not on that list, but it's on Vermont's, and they had an adverse reaction, the only recourse, because they can't go after the physician, the only recourse that the individual would have would be to directly sue the pharmaceutical company itself. And so all I was interested in is making sure people were aware that there is a different level of potential exposure, not the cost of the actual vaccine.
So Lauren, I think the proposal that is being raised is, whether, and you can correct me if I'm wrong, whether, what the health department's position would be on flagging, on public documentation, those immunizations that are recommended in Vermont, no longer recommended at the federal level, so as at some point in the future to potentially not be covered under the federal vaccine injury program.
Thank you. Sorry, I misunderstood before. So you're correct that it would, I mean, right now you have to get your own lawyer and petition the vaccine injury compensation program. So the distinction between doing that or going through the court system is, I don't know if there's a significant difference. And right now everything is covered still by the vaccine injury compensation program. So I wouldn't want to anticipate that something might be removed at a later date by providing an asterisk right now. I think, again, it could be a deterrent. And so I'm not sure that the Department of Health would support that. But if that is something that the public needs for information, we could consider it.
I don't think we need to do it if it's still covered, when it gets to that point. Because I think there is a huge difference in an individual having to sue directly a pharmaceutical company.
Right.
That's a huge undertaking.
Could we ask for notice when that happens?
What?
There's that if there is a difference between recommended vaccines at the federal and the state level, that this committee be notified or the emergency board be notified. I mean, we should know.
Who should know?
Somebody. And if that happens, then yeah, probably would want to put a little footnote somewhere that says if you have an adverse reaction to this.
Oh, how does the Department of Health handle that? If you have how is that handled? And how do you know? I'm trying to sort out how you understand the cause and effect relationship between a vaccination and a specific negative outcome. I know there are some that are very clear. And Guillain-Barré, for one, with certain flu vaccinations, but how do you know cause and effect with this stuff? And Lauren, so the question is having a notice about where to go if there's an adverse reaction. Where does that fit within either the advisory committee or the department's information itself?
Yeah, thank you. There is a vaccine adverse event system that you can report anything into. So folks, whether it's associated, whether it's not even associated, but somebody thinks it's associated, it gets reported to the system. The actual studies about adverse events are distinct from that reporting system. So if one, for right now, the vaccine injury compensation program at the federal level has a list of common, not common, but of events that are caused by the vaccine, like Guillain-Barré, for example. And if you come in and you petition and have that event, then you would be entitled to compensation pretty quickly without having to show causation. Otherwise, if it's a different injury, again, you're part of a litigation system in a tort system. It's just more internalized to the government and outside of our typical civil court system. So it's not hugely distinct. You still have to petition, you still have to go before a judge, you still have to show causation between the vaccine and the injury. And it can take years, and often the maximum is $200,000 to $250,000 for a life event.
Go ahead.
But I think if I followed what you were suggesting was when and if a recommended vaccine falls off that federal protection piece, but it's still recommended by the state of Vermont, that this committee be notified that that has occurred. So this committee could decide at that point in time whether they felt there was some notice or something required. Is that where you were at?
That's what I was thinking.
So, there is the vaccine information, sheet, and I'm setting a, who can comment on the VIS and where that is located.
That's at the CDC level. Anybody can comment on it, and a public comment. And then,
No, who could comment it for purposes of our understanding right here? Where does it live and how does it influence a patient decisions or whatever?
That's the thing they give you every time you get a flu shot.
Every time you get a flu
Might
shot, you
12
get
and
an
antigen.
Oh,
Yeah.
okay. Please, yeah, go ahead.
Stephanie Winters, I'm the Deputy Director of the Vermont Medical Society, as well as the Executive Director for the AAP, American Academy of Pediatrics Vermont chapter, and the Vermont Academy of Family Physicians. I think Meredith Plumpton, who's our immunization program manager, is listening, but probably not able to respond. But there are vaccine information sheets currently, and they already talk about the National Vaccine Injury Compensation Program, and they do not name which vaccines, and they do say certain vaccines are covered and can be compensated through this program. So they don't call out every one of them, and they say certain. So I think it's already on the vaccine information sheets, which are federally required to be given to every patient, and they don't currently call out every single vaccine.
Just clarity. If there is a difference between the CDC list and the Vermont Department of Health list, which we will be going by, and there is an adverse reaction, is that reaction still covered under the federal funding system? Or in that one event, is that family person that had the adverse reaction, their only option is to hire a tort attorney and go to court, which would be long and expensive.
this is Lauren.
Yeah,
This is Lauren Lehman again, for the department. So the, right now, all the vaccines are still covered, by VICP. So there's no distinction, and as long as they're covered, they would be. To your point, they wouldn't be able to go through the VICP, but I want to be clear that the VICP process is not easy and is not short and easy. And there's, some ways to shorten it if it's a known event, but it still takes years, and you still have to hire a lawyer, and you still have to go through that process. It's a different venue. And in that situation, your damages are capped, and you can't, you're actually getting less relief. So it's different. It would be a different process for that vaccine at the Vermont state level, but your potential for recovery is much higher as well.
okay, so the short answer is right now, there's a fund that's set up. And I have to hire a lawyer, and it's a long and probably expensive process to go through that. if the vaccine is on our list, if at some point in the future, but not on the federal list, then I would have to hire a lawyer, go to court and sue the vaccine manufacturer because the physician is protected, which is okay. So I would have to sue the manufacturer.
Yes,
Okay.
unless there was gross negligence mistake at the physician level.
Negligence, yeah.
Right.
Yeah, I knew this child was allergic to eggs. I still gave her the flu shot. Still has it.
Yep.
Okay.
Okay, the thing, I think the underlying proposal that we have from the Department of Health, and this is the administration's proposal, would preserve the current status for vaccinations in the state of
Yes.
Vermont.
Yeah.
I mean, I think that underlines what we're trying to do. It does help expand some of those who can administer vaccines, and very specifically through the, you know, the pharmacists, and then it also puts in the advisory committee at the state level, but to help preserve that, the data informed, science-based information.
Right.
Yeah.
But we're doing this because we're anticipating at some point
Exactly.
in the next few years, if that flu shots might be removed or whatever.
Right. Exactly.
I guess, but that does change. I guess the question is it significant if you have to hire a lawyer now and it takes you years of legal fees to get money from this fund? It might actually turn out to be shorter if you hire a lawyer and
Good
directly
point,
sue the
Senator.
manufacturer, but there would, the question is
Yeah.
is there a significant difference? I'm thinking there probably isn't. Okay.
Okay. Allison, did you want to say something?
I do, if you don't mind, it just might help clarify one thing. Allison Despatrick, Health Choice Vermont. I just wanted to say two pieces. One is there is at the federal level, with the Vaccine Injury Compensation Program, a table that acknowledges that if a certain vaccine causes this reaction and you report it and it
That's
happens,
what we've heard that.
but in
Yeah.
2 or 3 days, you're immediately covered.
Right.
So that would be a very quick turnaround time for those accepted pieces. And the other thing is a vaccine information statement sheet, as put out by the CDC for decades, has been known that this is not informed consent. So you get that sheet to be able to report to VAERS, but it's not informed consent. So thank you.
Good, thank you. And, okay, so, yeah, there are a lot, as soon as we start talking about vaccinations and immunization, everything sort of percolates to the top and we start all over again. What we're trying to do here with this bill is to ensure that if there are federal changes that are significantly different from what we have in the state, that we can preserve what we have in the states, going forward. Really better.
Cut staff in office.
Huh?
You don't cut staff in office.
We'll talk about that another. Yeah. All right, thank you.
You're welcome.
No, it's tough. We get into these conversations and they're really good conversations from every single point of view. I appreciate that. So on Tuesday, we'll come back to this and we'll do what we can do. I'm hoping that we could vote the amendments, proposed amendments out with the strike wall.
I'll have that ready for you.
All right, terrific. All right, Vinnie, Charlotte, did you hear back?
I did not.
Okay.
If I hear back about Tuesday morning, all that.
Yeah, thank you for that. We don't have time for, you know, it's always the time issue, but well, if he wants to testify and bring his proposal of amendment in here, we're certainly willing to look at it. I suspect that, you know, if he doesn't do it, someone will bring it up on the floor, but I'd like to consider it before we get to that stage. All right, so we are going to take a little break. Thank you, Lauren, for being with us.
Thank you.
And we'll take a break, and at 10:25, we'll be going back we'll go into room 11 We're gonna hear from some of the hospitals who have been working really hard to the select after we